everyone. It's Dr. Cynthia Hickman, your proactive caregiver advocate. Thanks for joining me today. Today we're going to talk about, is home medical equipment knowledge created equal? As our loved ones and care recipients get older and experience health challenges, medical equipment in the home may be required. Using medical equipment, also called durable medical equipment, DME, requires education, instruction, and return demonstration. Some medical equipment is complicated, and someone simply caring for another person may be frightened by how to use or make the medical equipment work. There are two types of considerations for caregiving equipment: the durable medical equipment, which I mentioned before, and disposable medical supplies. Both types are used in the home to make it easier to manage the basic needs and medical care of our loved ones. Mindfulness of cost, availability, and effectiveness is necessary for you to remember. Equipment as simple as blood pressure cuffs can be complicated if the individual does not understand how to put the cuff on, or what the information means in the readings, and when to report the information. What about a Hoyer lift? Have you seen the size and the attachments that go along with a Hoyer lift? Scary. And let us not talk about how big it is and where you need to store it. It's a monstrosity. What about equipment for requiring peritoneal dialysis? That's very important, and sterile technique needs to be managed with that. Some medical equipment is used for recuperation at home. Equipment of this nature may be hospital beds, walkers, canes, shower chairs, disposable gloves, crutches, oxygen, IV equipment in the home, just to name a few. Even after these items, proper instructions is still necessary, and return demonstration to make sure someone is doing them correctly. Remember, safety is always a concern, and falls are very prominent with medical equipment. Remember also that some equipment is for purchase, so make sure you inquire about that, because some insurance companies pay for medical equipment. So I asked the question, is home medical equipment knowledge created equal? No, it's not. Caregivers come with a role with many disadvantages, especially for those who may have been thrust in the role. Knowledge deficits are real, so it's important that we take the time to teach. As your proactive caregiver advocate, my passion and my role is to share ways to decrease the stress and emotional strain of the caregiving role. Remember, it's very important that we consider helping others with medical equipment. There were days I needed support, even though I was a nurse. So make sure that you take the time to educate a caregiver who's working with medical equipment. Take care, be well, and bye for now.